Radhe Radhe students, welcome back my YouTube channel Florence Nova. In this video, we are going to discuss ICD. ICD means International Classifications of Disease, and this is one of the most important topic for nursing, coding and medical record exams. By the end of this video, you will understand what ICD is and why we use it and how it is used in hospitals. Okay, first is ICD. ICD is the International Classifications of Disease. It is a system used worldwide to code a disease, injuries, and cause of death and health conditions. It is published by the World Health Organizations, and that is WHO. The main purpose of ICD is to maintain uniform data about disease all over the world. Okay, next is definitions. The ICD is a standardized framework used worldwide for categorize health conditions developed and maintained by WHO. Uh, Primary goals to ensure consistent and comparable health data collections and reporting across countries. Okay, next the use of ICD. ICD used in epidemiological research, health management, clinical documentations, and decisions making. Compile global data on disease prevalences and mortalities, health insurance reimbursement, and digital healthcare systems. Key point: ICD. ICD is the cornerstone for improving global health understandings and policy making and resource allocations. Okay, next, currently we have two main versions. ICD-10 is used in most countries, including India, and it has around 14,000 scores. And the newest version is ICD-11. WHO release it is 2018, and many countries are shifting to ICD-11 now. And ICD-11 is digital friendly and has more than 55,000 codes. Okay, so versions ICD-10 10th revisions used widely since 1994, means approx 25 years. Alpha numerical scores for disease symptoms and abnormal findings cover external causes of injuries and disease. ICD-11 11th revisions and adopted by WHO in May 2019, effective from Jan 1 2022, and more comprehensive, modern and detailed. As of Feb 2022, 35 countries had started implementations. Okay, next is purposes and uses of ICD. Let me explain how ICD code works. So first is standardizations. First, create a universal language for healthcare. Means एक universal language generate करता है, allow consistent data collections across countries. Data collections and analysis crucial for monitoring public health trends, conducting epidemiological research, planning and evaluating healthcare services, allocating healthcare resources. Next is clinical and administrative uses. First is diagnosing and treating patient, billing and reimbursement, tracking patient outcomes, then tracking improving qualities and safety of healthcare. Next is specific applications of ICD. First is public health, monitor disease outbreaks and train. Next, help government plan interventions. हेल्थ मैनेजमेंट के अंदर प्रोवाइड डाटा फॉर प्लानिंग एंड इवेलुएटिंग सर्विसेज, मेडिकल रिसर्च, standardizations way to classify and analyze health data, billing and reimbursement are used for insurance claim in many countries. Next is epidemiologically track incidence and privileges of disease, identify risk factors, monitor effectiveness of public health interventions. Clinical practices document diagnosis, then justify medical necessity, and then communications patient informations. समराइज करें तो आईसीडी इज ए वाइटल टूल फॉर ऑर्गेनाइजिंग एंड अंडरस्टैंडिंग हेल्थ इंफॉर्मेशन वर्ल्ड वाइड. ओके, नेक्स्ट है आईसीडी वर्सेस 10 वर्सेस 11. यूजेस की अगर हम बात करें तो डोमिनेंट है आपका ICD-10 डोमिनेंट सिस्टम फॉर मैनी ईयर्स की, जैसे अभी बताया 25 ईयर्स. एंड ICD-11 न्यूअर है, मोर मॉडर्न वर्जन्स है आपका. क्लासिफिकेशंस, डिटेल क्लासिफिकेशंस ऑफ डिजीज, देन मोर यूजर फ्रेंडली एंड क्लिनिकल रिलेवेंस. Modifications: ICD-10 CM, ICD-10 PCS used in US, ICD-11 better digital format. Technology: older format, ICD-11 compatible with EHR and incorporated new techniques. Coverage: basic coding including antimicrobial resistance, traditionally medicines, and languages primarily English, and यहाँ पे designed to be multilingual. ICD-10 एंड आपका ICD-11. कोडिंग दिया हुआ ICD-10 वर्जन्स एंड आपका ICD-11 वर्जन्स के अंदर. डिफरेंसेस क्या है कि रोमन वर्ड्स के अंदर यहाँ पे कैटेगराइज किया जाता था. जैसे फर्स्ट क्लास है आपका सर्टेन इन्फेक्शियस एंड पैरासिटिक डिजीज है. देन क्लास सेकंड जो था आपका न्यूप्लाज्म है. क्लास थर्ड डिजीज ऑफ द ब्लड एंड ब्लड फॉर्मिंग ऑर्गन्स एंड सर्टेन डिसऑर्डर्स इन्वॉल्विंग द इम्यून मैकेनिज्म. वहीं पे अगर आप ICD-11 को देखोगे तो जो क्लासिफिकेशन थर्ड था डिजीज ऑफ ब्लड और ब्लड फॉर्मिंग ऑर्गन्स. देन फोर्थ क्लास के अंदर डिवाइड कर दिया डिजीज ऑफ इम्यून सिस्टम. पहले ICD-10 के अंदर ये कंबाइंड फॉर्म में था, इम्यून सिस्टम ही हम साथ में पढ़ते थे ब्लड फॉर्मिंग डिजीजेस के साथ ही. अब ये सेपरेट हो गया है, ठीक है. तो उनको अंडरलाइन किया, जहाँ पे चेंजेस आया, यहाँ पे 22 कैटेगरीज थी, क्लासिफिकेशंस थी ICD-10 के अंदर. और वहीं पे आपका ICD-11 को आप देखोगे तो 26 फॉर्म में यहाँ पे क्लासिफाइड किया गया है आपके ICD-11 के अंदर. ओके, नेक्स्ट है आपका चैलेंजेस इन इम्प्लीमेंटिंग ICDs. मीन्स क्या चैलेंजेस यहाँ पे प्रेजेंट होती हैं आपकी. A need for regular updates and transitions difficulties. ICD-10 to ICD-11 transitions need extensive training, system upgraded required in hospitals and insurance databases. Means system update होंगे तभी वो उसको इंटेंड कर पाएंगे. Many countries including India are in early stage of adoptions. Then smaller hospitals with limited IT struggles to upgrade. Next, other challenges: lack of trained professionals, means proper coding needs, medical coders. Then error in data coding, human errors, inconsistent coding, integrations issues with EHR, difficulty in updating records, financial issues जैसे ट्रेनिंग प्लस IT infrastructures या सॉफ्टवेयर कॉस्ट, resistance to change, means lack of awareness among professionals. Next, lack of trained medical coder, proper ICD coding required skilled professionals. Many healthcare workers lack formal training. Then, rural area lack standardized coding practices. Error in data collections and coding, human error in assessing codes, wrong diagnosis, inconsistent use of coding guideline across hospitals, overlapping systems make precise coding difficulties. Next, integrations issues with EHR. Many hospitals still use paper-based records. Some EHR system not compatible with ICD-11. Lack of standardizations in digital health system. Next challenge is financials, resources, and constraint. ICD-11 need investment in training of doctor, nurses, coders, IT infrastructures for digitized coding, then software updated, then LMIC struggles with budget limitations. Next, resistance to changes, lack of awareness about benefits of ICD-11. Healthcare professional resist updating new systems, then privacy and data securities. Digitalizations increase risk of data branches, then many hospitals lack strong data securities. Then other challenges of ICD implementations: workload, adaptations issues, increased workload in learning new codes, and fear of documentations error affecting patient cares. Many doctor nurses prefer traditional paper-based methods. Next is privacy and data security concern. Digital ICD coding required secure data storage. The risk of unauthorized access and data branches. Many hospitals lack strong cyber security measures. Challenges in public health data analysis, coding errors, inaccurate disease surveillance, misleading health reports. Yeah, health policy makers rely on ICD data. Incorrect coding, yeah, ineffective public health decisions. Okay, roles and responsibilities in medical coding. First is nurse's role, provide detailed patient assessment, documentations patient conditions accurately, ensure proper documentations for current codings, then support data accuracy and patient safety. Doctor's roles is making final diagnosis, record diagnosis and treatment details, responsible for clinical accuracy in records. Medical considerations roles, convert diagnosis treatment into ICD codes, ensure correct code assessment, maintain billing and insurance documentations. Okay, thank you.